Hi, I'm Amelia Kennemer, and today I'm going to be doing a presentation on rational emotive behavioral therapy and its application in groups. Rational emotive behavior therapy, or REBT, was founded in the mid-1950s by Albert Ellis. This counseling model focuses on irrational thoughts, beliefs, and expectations an individual may accumulate. Although genetics can predict how some people may react to certain events, experiences, and trauma are known to be a main cause for our various perspectives. When we set goals or expectations and they are not met, this can bring up negative feelings like anger, frustration, guilt, and blame. It is the perception one has towards an event that forms a positive or negative emotion, not the actual event. These feelings have the ability to be reduced through various rational models and end up removing and replacing irrational emotions and behaviors. Is a term that personifies irrational thinking and takes form in three different parts. The first part is when one focuses on a I must, like I must get an A+ in my class or I'm a failure. The second form involves the thought you must. And the third part occurs when the individual feels strongly about a certain situation regarding conditions. An example of this would be if the weather condition doesn't change and stop raining here in Forks, Washington, I will never be happy. It is easy to see how these musts could potentially set someone up for negative emotions. REBT is a more scientific approach that works within the human brain and can be used for a wide variety of situations. This is commonly used in cognitive therapy, which is specific and goal-oriented, but also is included in self-help groups like SMART therapy and secular organizations for sobriety, which is based on addiction and maintaining recovery. These groups can range in time length depending on the person and severity of the situation. Usually, in cognitive therapies, meetings can be relatively short, like 1 to 2 times a week for 8 to 10 weeks. In rational therapy-based self-help groups can be indefinite in the sense that they are usually like a revolving door, occurring multiple times a week for anyone that would like to attend and can last years. REBT teaches skills that each person can utilize in future problems. This is why REBT fits with most groups and cultures. Rational therapy is easy to grasp and is applied based on the individual's specific thoughts. It is non-discriminatory in the sense that it forms to the person, no matter the issue, sex, religion, or cultural background. Rational emotive behavioral therapy has been proven to help with a variety of conditions and beliefs. It can help recovering addicts by its ability to implement tools needed to fight cravings, not use, and to help create a sense of acceptance. REBT is also known to help specific issues like anger management, depression, anxiety, PTSD, and compulsivity. To give an example of how rational emotive behavioral therapy can work in a group setting or individual setting, would say we have a situation that occurs usually in a child stage or adolescent stage. And then this event is perceived specifically by you in your brain, thus causing your belief or expectation. The goal of REBT would to be understand that this belief is unrational and is been caused by this event. But just because it was caused by this event doesn't mean that it's rational. So we would remove and replace it with a new belief, goal, or expectation. There are a plethora of rational therapeutic techniques or models that can be used to help teach the client skills in rational thinking. The models include disputation. Disputing irrational beliefs is key to unlocking rationality. In REBT, there are many different ways that one can dispute their beliefs, including functional, empirical, logical, and philosophical. The counselor can help the client dispute whether their belief will lead to a desired event or is functional. Determining if the belief is fact or opinion-based is included in empirical disputes. Helping the client decide if they are or are not forming a logical thinking process is consistent with logical disputes. And the act of questioning whether changing this belief will result in any amount of life pleasure is included in the philosophical disputing. All of these disputes can aid to the process of allowing the client to explore their perception. In REBT, there are 3 main processes that a counselor can work on with their group. This includes focusing on one's cognitive, emotive, and behavioral processes. Cognitive, or way of thinking, includes techniques such as the ABCs of rational emotive behavioral therapy, rational analysis through disputation of irrational beliefs, and reframing coping skills with new statements like I can instead of I can't. If a counselor decides to use the ABCs of rational emotive behavioral therapy, they can help each group member remove and replace certain beliefs or expectations. Let's start with A, or the activating event. And this event would cause the B, which is belief. And again, this belief is usually formed by one's upbringing, one's worldviews, anything that has caused traumatic stress, or anything that was instilled into them as a child or adolescent. C is the consequences. The consequence is what is going to happen if you believe or have a certain expectation and it's not met, or you believe something and it didn't happen, or you have a goal that was not reached. What are the consequences of that belief? D is the disputing. When you dispute your belief, you are going to ask questions and answers. Maybe this is a chance where you can maybe brainstorm some other ideas of what would happen if you did not have this belief. E is the effective thinking. During the effective thinking process, this refers to the original belief, and once you go through these steps, you are going to able to realize that this might be irrational and then form a new belief. Now, before the counseling process, usually it would stop right about here. Usually we aren't taught to dispute our own beliefs, so we end up just facing the consequences. It is after therapy has been done that you can then understand how your beliefs can be changed, your goals can be changed, or you can form new expectations. An example of emotive process model is rational emotive imagery. This is a technique in which the members imagine themselves being involved in a specific event. For instance, if someone has been in trouble for kleptomania, they could then imagine themselves being stared by everyone in the store as they go to grab an item that they would like to store somewhere on their body. They are usually instructed to imagine a situation at least once a day and sometimes multiple times a day to help instill a new habit. This is also called mantras. Behavioral methods include the understanding that one's behaviors can impact situations. These methods are sometimes used in conjunction with other processes. A commonly used model is the therapeutic active role-playing. An example of how this could be done is, say that you are nervous about a presentation. You may be asked to show what it is like to be nervous, then reenact what it would be like to present with great efficacy. Homework assignments are also proven to aid in the success of forming positive habits by disputing beliefs. These are usually done daily. Then, during group sessions, assignments can be shared with other members. It is important that each person completes their homework assignments because it holds them accountable and shows that they are autonomous. Rational emotive behavioral therapy is proven to be a successful evidence-based practice for group therapy and can help teach members skills that can have a huge impact on the rest of their lives. Because these skills don't discriminate, they can also be based down generations. I fully believe that once someone masters good habits of disputation, they will be able to have rewired their brain to start the road to unconditional acceptance, thus heading to a more rational, happy, and calmer lifestyle.